I know one family where the baby was due on Christmas and they really did not want a Christmas baby, so they had the baby a little early. Some women consider a C-section a failure of their womanhood, their body, and their rite of passage through labor. Some women need to be allowed to grieve for the loss of their imagined perfect birth. You can grieve. You can act like a death. A C-section in and of itself can lead to major postpartum depression. They may tend to be depressed, angry, guilty that they did not or could not deliver their baby vaginally, to the point of not wanting to care for the baby. They feel so bad about themselves. Women have a sense of failure, need to feel they're competent, which successful breastfeeding will help. They develop a fear of operations and surgery. I'm not going to have another baby because I have to have a C-section. Nope, not doing that again. Okay.
Get on it, Chris.
Now that we've said all that, let's see one.
C-section?
Yep. Yes. If tech support will help us.
What are we going to do next class when you're not here?
Yeah, I know. Well, actually, the last class we had a dad that helped too.
We
So
did.
usually we have a dad that will help us with tech support.
They're like, sure.
This video is going.
Is it?
Mm-hmm.
We'll have to restart it then. Or is it on the root menu?
No, it's 4 minutes in.
Okay, so just restart it.
It's probably the noise we were listening to at first.
Oh, you gotta unmute it too.
Turn it up if you need to. I was going to say, it's probably very low. You'll probably have to turn it up really high.
Do it all natural. I wanted to try to be a
Is that good or
hero
louder?
and
That's
not
good.
have any anesthesia.
Hey, down in
just
front.
medication.
Just move the mouse. Yeah.
Unfortunately,
Perfect.
there was another plan in store for us. I mean, I was going to do it natural. I wasn't going to have anything, you know. I was not going to even have an epidural, but reality set in. 12 hours into it, I was in quite a bit of pain, and the nurse said, honey, you need this epidural, and I said, okay. Basically, I was just thinking that, what's going on? Why didn't I dilate? No one's giving me any reason for not doing what I thought my body should do.
She labored for 26 hours, and she only dilated to 2 centimeters. So, I was thinking, let's get this over with. She's worked hard, she gave it a good try. Let's get the baby out.
By the way, 26
Came in
hours
and they
after
checked me,
C-section.
and I was still
Did you
not
say?
dilating, and he was still
My mom
talking
was
his
born
heart
late
rate,
with
and
me.
they said,
I
"You
used to
do
love
this
her.
very
I used to love
I was
her.
stubborn.
And she still loves you?
Yeah.
Go ahead,
know it 'cause she held it over your head.
That's how you know now.
After 21 hours of being induced, I couldn't dilate past a 5. So that's why I had my first C-section. My name is Lori, and this is Rachel, and she's about 6 months old. And I also have a son named Nicholas who's 4 years old. And I had a C-section with my son and also with Rachel. My name is Leanne Adams, and this is Connor Adams. He's 7 weeks old now, and we had a C-section. I'm Yolanda Attaway. This is my husband, Craig, and this is our baby, our first son. His name is Cairo. He's about 6 weeks old now. Nearly 25% of all births in the United States result in cesarean section surgery. As prevalent as the procedure is, the reasons for C-section and the surgery itself are often not understood. We spoke with several parents willing to share their experiences with C-section and followed one couple, Kelly and Jason Hill, through their 4th C-section birth.
I'm Dr. Gass, and we would ask you to take care of you today, okay? How many babies have you had?
4. Well, this is
This is your 4. Okay, so you had C-section before?
Of course, I did the prenatal classes, and when they showed the videos on C-sections, I I watched, but I didn't really pay close attention because I thought, that's not going to be me. Everyone always thinks that's not going to be me. So I just hardly watched it. And then after coming into the situation where I couldn't progress and couldn't have my baby, and they told me they had to do the C-section, all of a sudden it was like, what? I just thought that since I had done so well the whole 9 months that I would just deliver vaginally with no problem. I think I just had the wrong idea. Another often misunderstood part of C-section birth involves the anesthetics that are commonly used.
Some people do epidurals all the time, some people do spinal all the time. They both work, they're both safe. I just prefer the spinal.
I had a choice.
So
I
that's
could have
what I'm
chosen
saying, which
epidural
one
or I
she
could have
preferred
chosen
to do.
spinal. My physician advised me that whatever the anesthesiologist recommends is usually what they're the best at.
There are risks with any kind of anesthetics. There's always risk of you getting a headache from this. It lowers your blood pressure. That's why you give much IV fluid ahead of time to said that. And lots
With the spinal, the anesthesiologist had said that there are certain things that can happen in the OR. One was sometimes you have such a dense block that you can't feel yourself breathing. So you're like really, like I said, you're really, I hate to say paralyzed, but you really cannot feel yourself moving. And breathing is really something autonomic. I mean, you're doing it automatically, but you can't feel yourself breathe. And I had somewhat of panic. I was starting to kind of hyperventilate because I could not, it's like I couldn't catch my breath because I couldn't feel myself breathe. And she had to help me calm down. And she said it's very common that people sometimes, because they cannot feel anything. And with an epidural, you are blocked from pain, but you can still feel a little bit. But I could not feel anything, from chest level down. So I had that experience in the OR where I kind of really almost hyperventilated because I didn't feel like I was breathing, even though I really was. And another thing that happened was my blood pressure did drop pretty low, that I felt like I was going to be sick or pass out with the spinal. And of course, the anesthesiologist, your friend's there, she helped me and gave me something to raise my blood pressure back up, and I was fine.
And lots of people get nauseated. That has more to do with pulling around in your uterus. But if you warn me, if you start to feel that little queasy feeling, tell me early. I can give you medicine or IV that'll usually work.
You can almost guarantee most people throw up because they're pushing and pulling your insides around so much that it puts pressure on your stomach, and that kind of pushes everything out. Whether you were sick to your stomach before or not, it's not necessarily the medicines or anything that are going to make you sick, it's the pushing and pulling. And of course I threw up back there.
As long as you haven't ate a big meal, I guess every case is different. I hadn't had anything in a while. That somewhat prevents the nausea.
I'll warn everyone that push real hard on your abdomen right before the baby comes out. That's going to happen. You can feel, you can tell somebody's pressing on your abdomen, and you can kind of tell there's something going on with that, but you don't get.
With the first C-section, of course, I was very nervous, and I think they actually gave me something to calm me down, because I was, after kind of upset all of a sudden, oh, we're doing a C-section, and was really worried about it.
Before I knew it, I was on a stretcher and being rolled back, and I'm passing my mom in the hallway. She's crying.
And you're not in the most comfortable position as you lay there. They have you kind of propped to one side.
To me, it seemed like time just flew by, and I was back there before I could blink.
And once I got in there, I was moved from my bed to the operating table.
She's even
There's
tying
a
down her
flurry of
legs.
activity going on. I mean, there's nurses over here counting things and getting out all the instruments.
You go through there. Just going to make a mark when here was a turn. Yeah.
The anesthesiologist came in, and the doctor had already ordered a spinal anesthetic. And I was given that, and that was virtually painless also. I just leaned toward her, and I guess it was done between the vertebrae and my back, as I understand it from the childbirth classes.
You're going to be washing your back off now. This soap is very cold. It's been a sponge. It's cold soap. With the spinal, we clean it off thoroughly.
And the brown stuff is good again.
Pressing real hard with my fingers here.
This one is just Novocaine that doesn't
Just
put
sticking
in.
the burns. Stings like big old big stings for a few seconds. Get out. Big burn. Big burn. We numb the skin. Place like a tiny needle in the space until we get a little bit of spinal fluid.
So that is the actual spinal that's in.
In like 2 or 3 minutes, you're done.
When they roll you over, you've already had your anesthesia, so you can't really help much.
They have your arms strapped down so that you don't touch the sterile field, and so that, because you could forget. There's so much going on back there, it's easy to forget, so they have your arms strapped down.
We're going to test you to see how you've done this about it. So they're going to touch you with a needle and tell me if you feel anything sharp. If for any reason the spinal didn't work, we can always put you to sleep. It's not ever that you just have to bear it if you were uncomfortable.
After that, she began to talk to me a little bit and asked if I felt things, and then, of course, I didn't feel anything, I guess, below the waist. doctor immediately came in. The two most common C-section incisions are the transverse incision and in this procedure, the vertical incision.
Right when we were about to do the C-section, and they were prepping her inside, I had to wait outside. I had my scrubs on and everything. That's when emotion took me. Well, I couldn't help but think, in just a minute, I'm going to go in here and meet my son for the first time. And it was kind of emotional. I think that I'm the only one that cried.
You know, within 20 minutes, the baby was born after you rolled in, which is
You
just
can
amazing.
see with her, she has
So
a
it's
vertical
something
scar
pretty
from
quick, you
before.
know, that your end
That's why
result,
That's why they're
you know,
doing
that's the
vertical.
thing
They're
that you
going
look
through the
forward
same
to
scar.
for 9 months is fixing to happen.
They're gonna wait for the dad? You gonna
If
get
you
him?
have a good surgeon, you can't tell the difference.
My
until you
husband was
put
allowed
one
to
or
come back because I was awake. I wasn't going to be put under general anesthesia.
All right, here we go.
When you began to do the incision, it's not anything painful. You expect some excruciating pain.
Can't really see a whole lot. Oh, wait,
Transpires, you
never
just
mind.
feel
Oh,
I said never mind.
turning. But it's virtually, well, it was for me, virtually
Yeah, I
painful.
can't give myself a shot.
I really thought my husband would be like fainting on the floor, but he watched that whole thing.
I was in open abdomen.
oh my God.
So that was just muscles they were going through there.
But
Just muscles.
He was
That
sitting
works.
right next to me.
So how far
And
you
even
gotta
though the
get to
drape
the
was up,
baby?
he kind of could
Well, it's
peek
really
down
nice
for
to
a little
look
bit
at
and
calm
see
down.
every once in a while what was going on. So he was kind of giving me a
Skin,
live
fat,
reaction
muscle,
up there.
uterus. Yeah.
And kept asking the
They
doctors
still got
questions.
peppers.
But he did very well. He did better than what I
Oh.
thought. He wasn't even shaking. I was shaking, but I think it was a combination of being cold because your body's exposed, so that you are shaking a little bit, and they're giving you fluids, which are also not warm all the time, so that helps to make you cold as well. They're having a tug of war down there on your body.
So that's to pull the bladder down and out of the
Just
way.
a little tiny bit of movement. It's like you were gonna try to roll over at night.
They're
or
still
something.
not in the
You've been laying
uterus
the
yet.
wrong
They're
way
still
too
working to
long,
get
you're
to
kinda
it.
numb.
Tomorrow when I go to my
That's the
visit, she
sensation
comes
I
like,
guess
I'm
it
on
would be
the
like,
room.
you know, where it doesn't feel like your hand, but you know it's your hand. 'Cause
This is
it's
how they do
thick,
it.
you know.
Fixing to open the uterus.
So that's the uterus itself. And there's a reason they have that suction there. Because there's the fluid.
Got a little meconium stain down here. Lately. And we got a breech baby, that's all right. Wait just a minute, don't push yet, Chris.
This is how they do it.
Don't push yet. Push it out of there.
It's not like a pain.
Oh, God.
Yep. And you can see they're having a little trouble getting the shoulders out. They're having a little trouble getting the head out. That's why they do not want to deliver a baby breech vaginally.
Coming out backwards, okay. Get this little hand here. Easy now. Don't push hard. And lift him out of there. Come on in.
I'm dead.
You would survive it.
Oh,
There we go.
Lord have mercy.
There you go, little boy.
Oh, God. I take it that I've seen this before already.
I have I've never seen this video, but this
I've
kind of stuff
seen-
doesn't bother
I've seen
me.
some videos before, yes.
I was just looking at you guys like, you heard me not reacting the way I am.
Oh, my God.
I've seen this
is
video 4 times,
terrible.
like reacting similar.
This is the reason why I have
I
not gone
cried,
into the medical
and
field.
Chris peeked
Besides,
We watched.
I can't lie.
what's happening to me?
Oh,
Y'all watching the baby story?
if only she knew what was going on with her and her.
It wouldn't matter. She has to have it done. The baby has to come out.
Oh my
She's
God.
had 3 previous vertical C-sections. She's
the baby
not.
was breached.
Oh
Yeah.
my God, what is...
Okay, that's the placenta they're getting out.
Nutrition and a nurse
They don't
to
even
take
take
it on the wall.
baby, get him later, make sure
They
he's
don't do
okay.
any of that. And then
Okay, so they're taking the whole uterus out.
They take it out to inspect it, to make sure that there's not any problems.
Dude needs to learn how to swallow. I said that dude needs to learn how to
I know, right?
swallow.
I thought they were
He's watching
stitching up
his
my husband
baby.
peeked over and said, "Honey, they've got your uterus out. They're cleaning it all up for you."
I don't think I need that update.
Yeah, right.
You know,
I warned you about that
It's real
part.
gross looking.
So here they're starting to suture the inside.
oh, look at it.
Libby's hoping I'll have a girl.
Yeah?
She made a baby hat.
Oh, really?
And then when my husband was able to.
So if it's not a girl,
Yeah,
well, the boy just has to deal with it, I guess.
It's like this color with a green flower.
So you
Yeah.
can see Dad has the baby, but really that's all Mom's gonna get is kind of a look, a kiss maybe.
so grumpy.
Well, it was nice and warm and
Yeah,
comfortable in
super
there. What the
cozy.
heck?
Just floating around.
Yeah.
Didn't have to breathe on something.
Now that baby, they said the fluid was a little meconium state. Meconium is the baby's first bowel movement.
How big is, do they say how big that baby is?
It's an 8-pounder at least. He's huge, but maybe even bigger. But the thing is, if they have meconium, they can have some trouble breathing. That can be a reason for them to go to the nursery as well. Obviously, this kid's okay because they're continuing this video. There's staples.
Staples freak me out.
I'll go watch them.
No, just the look of them all
Look
together
at-
just creeps me out.
Look at the baby's mouth
My mom
movements.
is still
If you look at that, that's part of the 9
surgery.
steps. The baby is trying to do it even though Mom's not there.
It's very traumatic for them, and after the C-section was over, I
Like
thought
a mother-in-law.
I saw Brooklyn before everything.
Some moms don't care, but the one, my friend, man.
And this mom was awake and saw the baby in the OR and got a cuddle. So I would say she's not planning to breastfeed just from all the blankets from the way and all
Holding the baby
that.
for the first time, that's a tremendous feeling.
We would
It
still
is.
recommend skin to skin
I
when
guess to
you're
me,
not
I just knew
breastfeeding.
I'd carried him, for 9 months.
This
and
video
just
also
actually to have the end result, actually see what he looks like and touch him and have him look back at me, that it's a feeling you just really can't place a name on that. It's just an overwhelming feeling. You know, because immediately once I held him, I got to spend some time with him, it just felt like we began a bond. And it's just a feeling you just can't explain.
So his hands are a little blue. That's called acrocyanosis. It is normal for a newborn. He's fine.
Watch it again.
I
I can bring it to your house tomorrow.
I just cannot
Well,
believe
they
it.
won't let you do much after you've had a C-section because if you try to overdo it too quickly, you could end up with a hernia or, rupture your incision or something. So you're pretty much not exercising or doing anything for about 6 weeks. But if you don't get up right away, you could end up with all the surgical complications, pneumonia and that sort of thing. So they like for you to get up as soon as possible.
In the beginning, the first few days, it is tough and it is painful, but the more you get up and move, the less pain you have, the quicker recovery that you have.
It's a slow process, but you have to pretty much force yourself, motivate yourself to want to get up and be mobile.
When you're talking about the life of your child, you just don't want to take a chance. If a C-section is what you have to have done, then that's what you have to have done to bring a life into this world.
I would just say don't be afraid. If it comes down that you have to have one because of physical problems or the baby goes into stress, the birth of the baby is minimal. You've got all these years of the baby, and I don't think how the baby gets here is really that important as long as the baby gets here safely.
All I can say is don't be afraid of the C-section, and don't feel disappointed that you can't deliver vaginally, because there's no disappointment in a newborn. As long as your baby's here, your baby's here.
It's good to do it naturally, but if circumstances don't allow, rather than injuring your child, child, which is what will happen, it would be much better just to go ahead and have the C-section. A little scar heals up, bathing suits cover it up, shorts cover it up. You know, it's not that big of a deal. But to bring a healthy child into this world is much more important, I think.
You know, I thought I was going to have this, you know, natural birth, and I didn't do it. But my mother said the most wonderful thing. She said, you know, nobody walks around wearing a, merit badge. You know, when there is no badges because you had a vaginal birth or you didn't have anesthesia, have an epidural. And the most, the outcome of it is having a beautiful baby. And, that is your, prize.
Are we good?
Well, I'm gonna need you to plug that other one in, but I'm gonna shut this down for you. They told me, they were like, don't lift anything. Well,
Heavier than the baby.
but she was 9'8", so they were like, don't pick her up.
What
are you supposed to do? They were like, you can hold her and carry her, but don't pick her up. So I had to have someone come over and
Hand her to you?
have someone hand her to me, even to get her out of the bassinet for the first couple weeks. Someone had to hand her to me.
Does anybody need a break?
It's 7:38.
Are you serious?
Yep. Crap.
VBACs. So you can definitely have a vaginal birth after cesarean. It depends on a lot of factors. And it is true in the past, once a C-section, always a C-section. Research has changed this practice, and many women have been successful in having vaginal deliveries after a section. Some providers have started to encourage VBACs. The concerns are a uterine rupture related to the old incision, especially with that vertical incision. I think you have about a 9% chance of a rupture with the vertical incision versus a 0.1 to 0.2% chance with the horizontal. Documentation of a previous surgery is essential. Remember, what your skin looks like is not necessarily what your uterus looks like. Benefits: less recovery time, less risk associated with the surgery and the baby's respiratory problems, less separation between mom and baby, increased breastfeeding success, psychological boost. I did it. Birth plans. We're not going to do this part. Benefits of birth plans. Definitely is a very clear way to talk to your doctor about what you do and do not want. We do highly encourage a birth plan. We printed out, this is one of the things we're not allowed to give you, so we printed it out for you to see. This is a birth plan from a website called thebump.com. And basically the point of this is to be able to say, I am interested in having an epidural available. I do not want it pushed on me. I do want to be able to have my husband and my mom in the room, but I understand that my husband can only go with me to the operating room. Okay? Birth plans are very good. It will, especially one like this that's really long, is going to make you think about some of your options. And I highly encourage you to fill one out. Talk to your doctor about it and the like. Just don't marry it. In that, don't say to yourself, well, I've written down this birth plan and this is the way it's going to go. Because when one thing gets changed, that's when we get all those grief things. Common interventions address support people, doulas, labor positions, mobility and shower, food and fluids, heparin locks or IVs. Not mine.
Oh, maybe not.
It's hers. Okay. Electrical fetal monitoring, interventions, amniotomies, stripping membranes, admission procedures, labs, enemas, shave preps, urinary catheters, forceps and vacuum extractors, episiotomy, pushing positions, mirror squat bar, use of medications, comfort measures, aromatherapy, music lighting, and how you're going to immediately care for the newborn, cutting the cord, skin to skin, eye ointment, vitamin K shot, breastfeeding, cultural religious requirements with the placenta, the care of the mother and the baby, alternative plans if a cesarean should become necessary. Writing it, everything needs to be positive. We would like to avoid, if medically necessary, avoid any threatening. I'm going to sue you if I have a C-section is probably not the smart plan. And of course, goal statements and closing statements. Bonding is one of the most important things with your baby. The infant is going to have several different states: light sleep, active sleep, drowsy, quiet alert, active alert, and crying. I do not want to rush through bonding.
We can do it in the beginning next time.
That's true.
Would you guys be okay with that?
Yeah, whatever works for everybody else.
So,
This is kind of a really long section, and it's crucial. It's so important, and everything that you do with parenting and bonding is going to affect the rest of the baby's life.
so I'll stop there and save it for next time. We'll
Yeah.
start off with it. Next time is our last class, so because
Yes.
we're gonna push this there, just be prepared. You might be here a little bit extra longer because we definitely don't want to rush it and make sure that you guys get everything you need.
Right.
And we'd also like to do a little review at the very end, so that if you have any questions on anything, like we want to set up